Good evening, dear students. I am Dr. Ami Rawal, your original guru for dental anatomy and dental histology. So let's start with our most basic topic, that is tooth development. You will definitely get a question from tooth development, whether it is your university exam, whether it is your INICET exam, or it's your NEET exam. You always get a question from this topic. So be thorough with this topic. Now, tooth development. What is tooth development? It is mainly odontogenesis. Odontogenesis. Odonto meaning tooth and genesis meaning formation of tooth. So, tooth development is mainly odontogenesis. Odonto meaning tooth and genesis meaning formation. Which are the dental tissues forming a tooth? Enamel, dentine, pulp, cementum, and its surrounding structures that are periodontal ligament and alveolar bone. So how are these structures formed? This chapter is basically the formation of the dental tissues. So we will discuss in detail formation of enamel, dentine, root formation, cementum formation, right? So, all the dental tissues except enamel are derived from neural crest cells. Please remember this. This is an important MCQ question. All the dental tissues except enamel are derived from what? Neural crest cells. Now, what are these neural crest cells and how are they derived? And which structures are formed from this neural crest cells? So, basically, we know that a tooth is formed from neural crest cells. Only the tissue which is not formed from neural crest cell is our enamel. So, how are these cells formed? We see a thickening at the ectodermal portion of the head end of the embryo. This is neural plate. So in this diagram we can easily appreciate a neural plate. Neural plate. So we have thickening at head end of the embryo, mainly in the ectodermal portion. This is known as what? We have already discussed. This is neural plate. You can easily appreciate a neural plate in this diagram. This neural plate is basically thickening of ectodermal portion. Now, we can see some elevations on both the sides of the plate. These are its raised margins. What are these? Raised margins. Raised margins of this neural plate are known as neural folds. Neural folds. These raised margins are neural folds. Now, it encompasses a midline depression. Here we can easily appreciate a midline depression. What is this depression? It is a groove. So basically, this midline depression is our neural groove. Neural groove. So neural plate was thickening of the ectodermal portion of the head end of the embryo, then coming to its raised margins, which are neural folds. And this neural folds encompasses a midline depression, which is neural groove. Midline depression. Which is neural groove. Now, here we can appreciate that the folds are fused together. Folds have fused together. So, there is fusion of the neural folds here. Here we can see fusion of which folds? Neural folds. Which leads to the formation of, here we can see a tube-like structure, which is neural tube. So it leads to the formation of neural tube. Neural tube. This neural tube forms what? Brain and spinal cord. Brain and spinal cord. Now, at the crest portion of the neural folds, we can see a group of cells which undergo differentiation, proliferation and differentiation. Here, at the crest of the neural folds, we can appreciate what? Group of cells differentiating. This group of cells differentiated at the crest of the neural folds are our neural crest cells. Here we can see the crest of the neural fold, and there which cells are differentiated? Neural crest cells are differentiated. Group of the cells differentiate at the crest of the neural folds, and these are our neural crest cells which are involved in the formation of tooth. They basically form all the tissues of the tooth except enamel. So they are involved in the formation of tooth, they are involved in the formation of face, they are involved in the formation of cartilage, bone. They are also malignant producing cells are formed from neural crest cells. So basically, neural crest cells are group of cells that get differentiated at the crest of neural folds. They undergo extensive migration and differentiation and lead to the formation of primitive connective tissue, that is ectomesenchyme. This migration and proliferation leads to the formation of primitive connective tissue, which is known as ectomesenchyme. Involved in the formation of all the dental tissues except enamel. So all the dental tissues are basically formed from ectomesenchyme except enamel. So enamel will be formed from which portion? Epithelial portion, which is the ectodermal portion. So basically ectoderm is involved and ectomesenchyme is involved in tooth formation. So tooth development or odontogenesis is basically a complex phenomena involving interaction between ectoderm and ectomesenchyme. So you might not be having any doubt in neural crest cells now, right? So how are the neural crest cells formed? We have easily seen neural plate. We have neural plate formed by thickening of ectodermal portion of head end of the embryo. Then it has raised margins, which are neural folds, encompasses a midline depression, that is neural groove. This folds fuse together, and at the crest of this fold we have differentiation of group of cells, which are our neural crest cells. And these neural crest cells are involved in formation of all the tissues of the tooth except enamel. They form face, they form bone, they form cartilage, they form pigment producing cells, right? So these are basically group of cells differentiate at the crest of the neural folds. They undergo differentiation and migration, leading to the formation of primitive connective tissue, that is our ectomesenchyme. So enamel is formed from ectoderm and rest of the tissues are formed from ectomesenchyme. So odontogenesis is basically interaction between ectoderm and ectomesenchyme. Now what is this ectoderm? What is this ectomesenchyme? We have understood ectomesenchyme. It is mainly formed by proliferation of neural crest cells, right? This is basic. And ectoderm is epithelial portion. So ectoderm basically consists of 2 to 3 cell layered stratified squamous epithelium. It is mainly 2 to 3 cell layered stratified squamous epithelium. So if this is our epithelium, then we can easily appreciate okay. So this is our epithelium, this is our basement membrane separating the epithelium and the connective tissue. Which portion is this? Ectodermal portion. Ectodermal portion. And beneath the ectoderm we have our ectomesenchyme consisting of connective tissue, blood vessels, right? Fibers. This is our connective tissue portion. So this is our ectomesenchyme. Whole tooth development is based on the structures ectoderm and ectomesenchyme. Interaction between both the structures. Now what happens? Ectoderm is separated from the endoderm of the foregut by a buccopharyngeal membrane. Okay. Ectoderm of oral cavity is also known as stomatodium. Primitive oral cavity is known as stomatodium. So it is basically what? 2 to 3 cell layered stratified squamous epithelium. Endoderm of foregut by buccopharyngeal membrane. This buccopharyngeal membrane ruptures at 27th week of gestation, leading to connection between the ectoderm and the endoderm. So, endoderm of the foregut is separated from the ectoderm by a buccopharyngeal membrane, which ruptures at 27th week of gestation. Sorry, 27th day of gestation. Ruptures at 27th day of gestation. So as a result of which ectoderm and endoderm come in contact with each other, and it is at this stage which initiates the tooth development. And at this point our tooth development is initiated when the buccopharyngeal membrane ruptures. Now we have already seen in the diagram ectoderm is surrounding what? Our primitive ectomesenchyme. After receiving signal from the ectomesenchyme, at about 6 weeks, this ectoderm layer, certain cells of ectoderm proliferate more rapidly than its adjacent cells, right? Here we can see. Now interaction begins between the ectoderm and the endoderm. This cells, basal cells of the oral ectoderm proliferate more rapidly once it establishes contact between the ectoderm and the ectomesenchyme. Right? So, once it gets signal from the ectomesenchyme, certain basal cells of oral ectoderm proliferate more rapidly as compared to its adjacent cells, leading to the formation of primary epithelial band. Certain basal cells proliferate more rapidly than adjacent cells. Now, leading to the formation of primary epithelial band. What is this primary epithelial band and what this primary epithelial band leads to? We will discuss. Primary epithelial band is basically proliferation of basal cells of oral ectoderm leading to a thickened epithelial band. This whole process takes place at 6th week. So at 6th week, this primary epithelial band is formed. At 6th week of intrauterine life, what will happen? Our primary epithelial band will be formed by the proliferation of ectodermal cells. This primary epithelial band is mainly a horseshoe shaped band. It is mainly a horseshoe shaped band. It corresponds to the location of future dental arches, that is maxillary arch or mandibular arch, and it also corresponds to the position of the future tooth germs. So, corresponds to the formation of future dental arches. In this diagram, we can easily appreciate the thickening of our primary epithelial band, right? This is thickened ectoderm. This is ectodermal portion. This portion is our ectoderm, and this is our ectomesenchyme. So, slight invagination of ectoderm is seen in underlying ectomesenchyme. This is our primary epithelial band by the proliferation of the ectodermal portion. So, when is the primary epithelial band formed? It is formed mainly at the 6th week because of the proliferation and differentiation of the basal cells of oral ectoderm, leading to a horseshoe shaped band or horseshoe shaped structure, which corresponds to the location of future dental arches. Now at about 7 weeks, this primary epithelial band extends into dental lamina and vestibular lamina. It has 2 extensions. Here we can see this is our dental lamina, and vestibular lamina. This is vestibular lamina. So, buccal to the dental lamina is always vestibular lamina. So, there are 2 extensions of primary epithelial band. Which are the 2 extensions? Dental lamina and vestibular lamina. And at which weeks they are formed? 7 weeks. At 7th week, this primary epithelial band divides into what? Dental lamina and vestibular lamina. These structures are very important in the formation of tooth. Dental lamina basically are ovoid swellings. They are again formed by the proliferation of the cells leading to ovoid swellings, which represent enamel organ of the developing tooth. And vestibular lamina, from the word itself, we can say it helps in the formation of vestibule. That is a hollow structure formed between teeth and lips and the cheeks. So coming to dental lamina. Dental lamina is basically a transient structure. It is not permanent structure. Transient means temporary structure. It will disappear after some time. Basically, activity of dental lamina is mainly for 5 years. Is for 5 years, after which dental lamina will disintegrate because of the invasion by the underlying actomesenchyme. So in this diagram we can easily appreciate dental lamina. This is our primary epithelial band and these are our ovoid swellings. Ten ovoid swellings are formed by the proliferation of the cells, and these swellings are dental lamina, which represents enamel organ for the developing tooth, which acts as a primordium for the developing tooth. So it can act as a primordium for deciduous tooth also and permanent tooth. So basically, function of dental lamina is indirectly it acts as a primordium for formation of here we are getting 10. Here in this diagram we can easily appreciate 10 ovoid swellings, right? So 10 primary tooth are 5 in each quadrant, right? So we have total 10 tooth in each arch. So this diagram is of arch, single arch having 10 ovoid swellings. So basically this is diagram of deciduous tooth. So dental lamina is definitely involved in the formation of deciduous tooth and permanent tooth. So it acts as a primordium for developing tooth. It appears as ovoid swellings formed by the proliferation of the ectodermal cells. These ovoid swellings mainly represent enamel organ for developing tooth. Enamel organ of developing tooth. To be more precise, this enamel organ leads to the formation of, from the word itself we can say enamel. So enamel organ will lead to the formation of enamel. Right? So enamel is an ectodermal structure now or ectomesenchyme. From what is enamel derived? Ectoderm or ectomesenchyme? Obviously ectoderm. Because of the proliferation of the ectodermal cells, we are getting ovoid swellings. This is our epithelium, right? So the basal cells are proliferating, leading to ovoid swellings. So this swelling is mainly enamel organ. Enamel organ. And this portion connecting the enamel organ and the ectoderm is our dental lamina. Dental lamina. Right? So this connecting portion between the ectoderm and the enamel organ is our dental lamina, and the ovoid swelling is our enamel organ. So enamel organ leads to the formation of enamel, and rest of the tissues are formed from the surrounding ectomesenchyme, which is our primitive connective tissue. So we have our question answered, that all the dental tissues except enamel are formed from neural crest cells. And why? Because enamel is mainly an ectodermal structure derived from enamel organ. Remember this. This is an important MCQ question. Can be asked in INICT, can be asked in your NEET, can be asked in your Viva question. Recent INICT question was, all the dental tissues are derived from either ectoderm only, ectoderm and mesoderm, ectoderm, mesoderm, or only mesoderm. So our answer is ectoderm and mesodermal portion, which is our ectomesenchymal portion. So two layers are involved, ectodermal portion and mesodermal portion. So don't get confused in this. Remember, enamel organ forms enamel, and it is mainly an ectodermal structure. So dental lamina is basically formed by the proliferation of our ectoderm, which leads to the formation of ovoid swellings at 10 different locations in our dental arch, and these are our primordium for the developing tooth. Developing tooth may involve deciduous, permanent, or primary tooth. So dental lamina is basically involved in the formation of deciduous tooth, permanent tooth. Now in permanent tooth we have two subdivisions, succedaneous tooth and non-succedaneous tooth. So what are the succedaneous tooth and what are non-succedaneous tooth? These are mainly permanent tooth, right? Succedaneous tooth are the tooth that have their preceding deciduous tooth, that replace the preceding deciduous tooth. Once the deciduous teeth shed off, this permanent tooth will take their place. So they are known as succedaneous tooth. So in primary tooth, which tooths we have? Central incisor, lateral incisor, same. Permanent tooth we have central and lateral incisor. So when our deciduous central incisor will shed off, our primary central incisor will shed off, then permanent central incisor will take its place. So permanent central incisor will be a succedaneous teeth. Coming to the lateral incisor, it will be replaced by permanent lateral incisor. Yes. Canine, obviously it will be replaced by permanent canine. Now coming to premolars. Do we have premolars in primary dentition? No. We will have molars. So first primary molar will be replaced by our first permanent premolar, right? And second primary molar will be replaced by our second permanent premolar. Till here, till premolar, we have our preceding deciduous teeth, and these teeth are replacing them, so they are succedaneous teeth. So incisor, canine, first premolar and second premolar are our succedaneous teeth. Remaining are which tooth? Which tooth are remaining from permanent dentition? Molars. Permanent molars. First, second and third molar. They will not be replacing any of the deciduous teeth. So they are known as non-succedaneous teeth. They are known as non-succedaneous tooth. First molar, second molar and third molar are mainly non-succedaneous tooth. So please remember, this is very important. Which are the succedaneous tooth? The permanent tooth which replace the deciduous tooth are succedaneous tooth. So our permanent central incisor, lateral incisor, permanent canine, first premolar and second premolar are succedaneous tooth, while our non-succedaneous tooth are our permanent molars. So both the succedaneous tooth as well as non-succedaneous tooth arise from different extension of dental lamina. Succedaneous tooth arise from lingual extension of dental lamina. Lingual extension of dental lamina. Again, this is important question. Succedaneous tooth arise from which extension of dental lamina? So we have, it arises from lingual extension of dental lamina, and this lingual extension of dental lamina is known as successional lamina. It is known as successional lamina. So if you are asked what is successional lamina, then what will be your answer? Successional lamina is mainly lingual extension of dental lamina. Successional lamina is mainly lingual extension of dental lamina. Now coming to the non-succedaneous teeth. They arise from same extension of dental lamina? No. They will arise from distal extension of dental lamina. So here, till here our succedaneous teeth will arising from lingual extension. This will be our distal extension. This is our midline. So away from the midline is our distal extension. This portion is our distal extension. So permanent molar will arise from distal extension of dental lamina. So in dental lamina, we have studied many things, right? What is dental lamina? How is dental lamina formed? Dental functions of dental lamina, activity of dental lamina. Now we have already discussed it is a transient structure. Its activity is of 5 years only. So the successional lamina gives rise to succedaneous teeth. Succedaneous teeth arise between timings 5th month in utero, that is our central incisors, to 10th month after birth. While our molars, first molar 4th month in utero, second molar first year after birth, and third molar 5th year, the end of 5th year. So till 5th year, our dental lamina will be active in the third molar region, after which disintegration of dental lamina will start, as a result of which activity of dental lamina is mainly of 5 years. So why activity of dental lamina is of 5 years? Because it will be active in only third molar region till 5 years, and rest of the time for succedaneous teeth 5th month in utero to 10th month, which are for premolars, and for first molar 4th month in utero, second molar first year after birth, and for third molar 5th year. After which, this is our dental lamina, right? And surrounding ectomesenchyme will invaginate our dental lamina, and there will be disintegration of dental lamina. Now during the disintegration, some remnants of dental lamina will be left behind, which are known as cell rest of serrae. So again, important question: remnants of dental lamina are known as cell rests of serrae. So after 5 years, after the disintegration of dental lamina, only the bud portion will be present. What will happen? Dental lamina will disintegrate, but some remnants of dental lamina may persist in the jaw as well as in gingiva. These remnants of dental lamina are known as cell rests of serrae. Right? So dental lamina is also a very important topic. We had started with our primary epithelial band, thickening of the band, its proliferation leading to the formation of enamel organ. Enamel organ will form what? Enamel. And dental lamina is basically a transient structure which is active only for 5 years, after which it disintegrates, and the remnants of the dental lamina are known as cell rests of serrae. This dental lamina has basically 3 functions. It is involved in the formation of deciduous tooth. It provides primordium for deciduous tooth, permanent tooth, which are succedaneous as well as non-succedaneous tooth. Succedaneous tooth replacing our primary tooth, and they arise from which extension of dental lamina? Lingual extension of dental lamina. They arise from lingual extension of dental lamina. Lingual extension of dental lamina is known as successional lamina. It is known as successional lamina. Non-succedaneous tooth arise from distal extension of dental lamina. And which are the non-succedaneous tooth? Our permanent molars are non-succedaneous tooth. So they arise from distal extension of dental lamina. Now coming to vestibular lamina. Vestibular lamina is also known as lip furrow band. It is known as lip furrow band. Vestibular lamina is present where? Lingual or buccal to dental lamina? Buccal to dental lamina. It is present buccal to dental lamina. Here the cells might proliferate, they might enlarge, and then they degenerate. Cells of the ectoderm proliferate, enlarge, and then degenerate. Leading to formation of a hollowed structure. Here we can easily appreciate a hollow structure. Leading to hollowing with the formation of vestibule. It leads to the formation of vestibule. This vestibule is present where? Between the tooth bearing region and lips and the cheeks. In this diagram we can easily appreciate this. We can see this is our dental lamina, primordium for tooth gum, right? And here we can see a hollow structure, that is our vestibular lamina. This is our vestibular lamina. Leading to the formation of vestibule. So in this diagram we have already seen vestibular lamina as well as dental lamina. This buccal to the dental lamina is our vestibular lamina. These cells will enlarge, then they will degenerate, leading to the hollowing of the structure, which is known as vestibule. So till now basically we have understood that the oral ectoderm was present, right? 2 to 3 cell layered stratified squamous epithelium. It is basically underlying was our ectomesenchyme, right? Because of the interaction between ectoderm and ectomesenchyme, right? What was happening? Proliferation of the cells was taking place. So there was proliferation of basal cells in the underlying ectomesenchyme. Here dental lamina was formed. So basically a tooth germ consists of 3 structures. Ectodermal portion, that is our enamel organ. Till now we have studied till enamel organ. And underlying ectomesenchyme, which will give rise to again 2 structure, that is dental papilla and dental sac, which will be studying in later stages of tooth development. So ectoderm, ectomesenchyme, then proliferation of the basal cells leading to the formation of enamel organ. Based on the morphology of this enamel organ, we have its stages divided, which are morphologic stages, and based on its function, which is physiological stages, also we have 5 stages. This enamel organ will give rise to enamel. So based on the shape of enamel organ, morphology of the enamel organ, due to the proliferation of the cells, what is happening? We are getting our morphological stages of tooth development. So morphologic stages include bud stage, cap stage, bell stage, early bell stage and advanced bell stage. And physiologic stages include initiation, proliferation, histodifferentiation, morphodifferentiation and apposition. So basically we have 2 stages, morphologic stages and physiologic stages. Morphologic stages based on the shape of the enamel organ, bud stage, cap stage in the form of a cap, we can see, because of unequal proliferation of the cells, unequal rate of proliferation of the basal cells. Bell stage, we have early bell stage and advanced bell stage, after which we have root formation. And physiologic stages include initiation, proliferation of the cells, histodifferentiation, morphodifferentiation and apposition. Initiation stage is from 6th to 7th week, bud stage 8th week, cap stage 9th to 10th week and bell stage 11th to 12th week. So these are basic information about the stages. Initiation stage, bud stage. When does the initiation stage start? 6th week, where our primary epithelial band was formed. Later it divided at 7th week into dental lamina and vestibular lamina. Bud stage 8th week, cap stage 9th to 10th week and bell stage 11th to 12th week. In this diagram we can see A is bud stage, B is cap stage in the form of a cap, C is bell stage, bell like, right? Then here we can see formation of one hard tissue, that is our dentine. E is, we can see 2 dental tissues formed, which is here upper one is enamel, lower one is dentine. Then we have whole crown formation is completed, right? Here we can easily appreciate that root formation is completed, almost started, and in the last stage we have seen completion of the root. We can easily appreciate the closing of the apical foramen in this stage. So based on the morphology, they have divided bud stage, cap stage, early Bell stage and advanced Bell stage. And which are the physiologic stages? Initiation, proliferation, histodifferentiation, morphodifferentiation, and apposition. Now coming to the bud stage. Here, bud stage, we are having this type of shape, right? So basically we are having two cell layered structure here. We are having two layers of cell here. At the periphery we are having low columnar cells. These are low columnar cells, and centrally we are having polyhedral cells. So the ectoderm, because of the proliferation of the basal cells, have received which shape? Bird shape. It forms a bird shaped structure. And this bird shaped structure is our enamel organ. Derived from what? Ectoderm. And surrounding this we have ectomesenchymal cells. So in bird stage we have basically two layers present in enamel organ. Outermost layer is low columnar. And central cells we have polyhedral cells. Centrally we have polyhedral cells. In this diagram also we can easily appreciate the difference between the cells. These are our outermost layer, which are low columnar cells, and these are our polyhedral cells. Central we have polyhedral cells. Bird shaped enamel organ. This is our dental lamina, and surrounding structure is our ectomesenchyme. This portion is our ectomesenchyme. Immediately adjacent to the enamel organ, here we can easily appreciate the condensation of ectomesenchymal cells. This condensation of ectomesenchymal cells just adjacent to the enamel organ is our dental papilla. Dental papilla. Condensation of ectomesenchymal cells just adjacent to our enamel organ is dental papilla. So basically, initially we are having two layers, outermost low columnar and central polyhedral cells. Now surrounding this we have condensation of ectomesenchymal cells just adjacent to the enamel organ. This is our dental papilla. So what is dental papilla? Condensation of ectomesenchymal cells surrounding the enamel organ. And again we have a structure here which is surrounding both condensed ectomesenchymal cells as well as the enamel organ. This is our enamel organ. This is our enamel organ. So the structure surrounding both enamel organ as well as dental papilla is our dental sac. Condensation of ectomesenchyme surrounding both. Surrounds both enamel organ as well as dental papilla. This is our dental sac. So now we can easily appreciate in this diagram, in birth stage, this is our enamel organ, right? Condensation of the cells adjacent to the enamel organ is our dental papilla, and condensation of the ectomesenchyme surrounding both enamel organ as well as dental papilla is our dental sac, right? So this blue portion is our dental sac. Now can you tell me that this dental papilla and dental sac are ectodermal structures or ectomesenchymal structure? This is what this whole is, our ectomesenchyme. Ectomesenchyme. This is our ectomesenchymal portion. So basically dental papilla and dental sac are ectomesenchymal structures, and ectomesenchyme is derived from neural crest cells. So rest of the dental tissues will be formed from dental papilla and dental sac, while only enamel was formed from enamel organ. And this three structures basically form a tooth germ. So tooth germ is formed basically by these three structures. Is formed by this basic three structures. Which are the three structures? Enamel organ, dental papilla, and dental sac. So please remember this. A tooth germ is formed mainly of enamel organ, dental papilla and dental sac. Dental papilla and dental sac are ectomesenchyme in origin, right? And enamel organ is ectodermal in origin. And from the diagram also you can now easily appreciate, right? Enamel organ, low columnar cells, outermost low columnar cells, and central polyhedral cells. Two-cell layered, this is our enamel organ. Condensation of ectomesenchymal cells just adjacent to the enamel organ is dental papilla. And condensation of ectomesenchyme surrounding both enamel organ and dental papilla is our dental sac. So bud stage we have completed. Because of the proliferation of the basal cells of the oral ectoderm, we are getting our bud shaped enamel organ. Now coming to cap stage. From the word itself we can say cap stage. So what is the shape of enamel organ here? Cap shaped structure because of unequal rate of proliferation of the cells. Unequal rate of proliferation of the cells leading to a cap shaped structure of enamel organ. This is basically our cap shaped structure. Now here we will have 3 layers. Which are the 3 layers seen here? One, we will have cuboidal cells present in the convexity of the enamel organ, right? So this cuboidal cells are our outer enamel epithelium. Outer enamel epithelium. Cuboidal cells present in the convexity of the enamel organ. These are our outer enamel epithelium. So one layer is, 3 layers are present here. First layer, in the convexity we will have cuboidal cells, right? In the convexity we will have cuboidal cells. In the concavity we will have columnar cells. Here we will have columnar cells. Tall columnar cells in the concavity. This is our inner enamel epithelium. Right? So cuboidal cells are present in the convexity of the cap and tall columnar cells are present in the concavity of the enamel organ. These are our inner enamel epithelial cells. And third layer is our central layer. In Bird's stage, we were having central cells having the shape of polyhedral cells, right? Centrally they are polyhedral cells. But these polyhedral cells are rich in glycosaminoglycans. So what will happen? Being rich in polyhedral cells are rich in what? Glycosaminoglycans. These glycosaminoglycans are mainly hydrophilic. They are water loving. They will absorb water, as a result of which the cells will start moving away from each other. But to maintain contact with each other, they form a star-shaped network. They form a star-shaped network. They are mainly hydrophilic. Being hydrophilic, they absorb water. As they absorb water, the cells will start moving away from each other. But they will absorb water. Why? Because of the osmotic pressure. Osmotic pressure. So the cells will move away from each other, but to maintain contact, they will form a star-shaped network. As a result of which they are known as stellate reticulum cells. Stellate reticulum cells. Stellate meaning star-shaped network. So this become this type of cells. Star-shaped cells. They become star-shaped cells. Right? So here this polyhedral cells will now become star-shaped. Right? So why the polyhedral cells are becoming star-shaped? Because they contain glycosaminoglycans. These are mainly hydrophilic. They will absorb water because of osmotic pressure. As a result of which the cells will start moving away from each other. But to maintain contact, they form a star-shaped network, which is known as stellate reticulum. Now, in between these cells, we will have a mucoid material. They are rich in mucoid material. Between these cells, the substance present is rich in mucoid material, which is mainly albumin. Albumin. It is rich in albumin. So, what will be the function of stellate reticulum cells? It will mainly act as a shock absorber. It provides cushion-like consistency and it acts as a shock absorber. And it protects the underlying enamel forming cells. Okay. So, in cap stage, what will happen? In this diagram, we can easily see we have a cap-shaped enamel organ. This is our dental lamina. This is our enamel organ. Now, we have two layers mainly. Outer two layers and one central cells. Basically, three layers. the cells in the convexity of the enamel organ are low cuboidal cells, and which is it constitutes our outer enamel epithelium. Cells in the concavity of the enamel organ are tall columnar cells, and they constitute our inner enamel epithelium. And central cells are stellate reticulum cells, which are star-shaped cells. Initially they were polyhedral, but being hydrophilic, containing glycosaminoglycans, they form a star-shaped network. And in between them, they have a material rich in mucoid, which is mainly albumin, which provides cushion-like consistency. It acts as a shock absorber, and it protects the underlying enamel structure. So basically, we have 3 layers in the cap stage. In bud stage, we had 3 or 2 layers? 2 layers. Outer, low columnar cells, central, polyhedral cells. Now coming to the cap stage, cells in the convexity, outer enamel epithelium, concavity, inner enamel epithelium, and stellate reticulum cells. Here we can easily appreciate our 3 different layers. Now in the cap stage, we will be having some transient structures. Transient structures, again same as dental lamina. Transient means temporary. So they might disappear after the formation of, once the formation of enamel starts. So these are temporary structures. Temporary structures will be enamel knot. You can be asked which are the transient structures. Enamel knot, enamel cord, enamel navel, and enamel septum. Enamel knot, enamel cord, enamel navel, and enamel septum are basically the transient structures. They might disappear during the formation of enamel. Now what is enamel knot? Here we can see condensation of cells near the inner enamel epithelium, which form a knob-like extension. Enamel cord, it is vertical extension of enamel knot, just like a cord of a charger we are having, right? So it is mainly vertical extension of enamel knot towards the outer enamel epithelium. So this is our, if this is our enamel knot, then its extension towards the outer enamel epithelium is cord. The point where the cord meets the outer enamel epithelium is our enamel septum here. This point will be our enamel septum, and at this point we can see a depression just as a navel. So hence it is known as enamel navel. In this slide we can easily see cells in the concavity of the cap of the enamel organ are densely packed and form a knob-like enlargement towards the dental papilla. These are our enamel knot. Now what is the function of enamel knot? This is an important MCQ question. It was asked in one of your NEET exams. Function of enamel knot, it acts as a signaling center. It acts as a reservoir of dividing cells. So it acts as a reservoir, it acts as a signaling center, and plays an important role in determining the shape of the tooth. So basically enamel knot has 3 functions. Which are the 3 functions? Reservoir of dividing cells, signaling center, and it determines the shape of the tooth, shape of the cusp or shape of the tooth. So we have three functions of enamel knot. It acts as a reservoir of dividing cells, it acts as a signaling center, and it determines the shape of the tooth. Now enamel cord we have already discussed. It is also a signaling center. Enamel septum, when the cord beats the outer enamel epithelium, it is enamel septum. And last is enamel navel, that is a small depression that forms at the junction of enamel septum and outer enamel epithelium. So in university exam also you can be asked which are the transient structures. Basically there are four: knot, cord, navel, septum. Knot is condensation of the cells and they form a knob-like extension towards the dental papilla. This is our enamel knot. Then its extension is enamel cord. This is our outer enamel epithelium, right? So towards the outer enamel epithelium, vertical extension of knot is enamel cord. The point where it meets, it is enamel septum, and the depression is enamel navel. We have also one structure, that is enamel niche. Enamel niche, basically it is formed in the plane of histological section, right? It is because sometimes ectomesenchymal tissue may be entrapped in the ectodermal portion. That is, it may be entrapped by the dental lamina. So it gives the appearance of enamel niche. Enamel niche. So in cap stage, we have discussed the layers of the cap stage, how the stellate reticulum cells are formed, what are its functions. Mainly it provides cushion-like consistency and it acts as a shock absorber because of the albumin present in it. And we have discussed the transient structures. And you should not be having any doubt regarding the tooth gum structures forming the tooth gum. So tooth gum basically has three parts: enamel organ, dental papilla, and dental sac. Same way here also in the cap stage we can easily appreciate the dental papilla and dental sac. Right? In this diagram, this condensation of ectomesenchymal cells just adjacent to the enamel organ. This is our enamel organ. So this will be our dental papilla. And condensation of ectomesenchymal cells surrounding both enamel organ as well as dental papilla is our dental sac or dental follicle. Right? So tooth gum basically consists of three structures, that is enamel organ, dental papilla, and dental sac. Dental papilla and dental sac, from the diagram itself we can say they are ectomesenchymal in origin and enamel organ is ectodermal in origin. Here we can see the epithelial cells, proliferation of epithelial cells, that is it is mainly ectodermal in origin. So enamel is formed from enamel organ and dental papilla will form what? Dentine and pulp, and dental sac will form cap. Always remember this. Enamel organ leads to the formation of enamel, right? Dental papilla DP, Dental papilla stands for D and P. So it will form D and P, DP. Dentine and pulp. Dental papilla will form DP, dentine and pulp. Remember as DP. D for dental and P for papilla. So it will form D and P, dentine and pulp. And our dental sac or dental follicle will form CAP, cap. It will form cap. Cementum, alveolar bone and periodontal ligament. Cementum, alveolar bone and periodontal ligament. So please remember this important MCQ question. Enamel is formed from what? Enamel organ. Dental papilla forms what? D and P, dentine and pulp. Dental sac forms what? Cap. C for cementum, A for alveolar bone and P for periodontal ligament. This is basic question that can be asked from tooth development. Dental sac forms what? Cap. Cementum, alveolar bone and periodontal ligament. Dental papilla, D and P, dentine and pulp. Enamel organ, enamel and dentine. Right? Now we'll take a short break of 10 to 15 minutes and we will be back with our bell stage. Right? So meet you in a short time again. Take a short break and we will be back.